Hi, we're Group 13, and this is our Sexual Health for Latinas mini presentation.
Our prevention program is designed to increase the use of contraceptives among Latina teens in order to help prevent unintended pregnancies. We plan on using the school program in order to provide sexual education on contraceptives and counseling. The after-school programs will take place in 2 southern San Diego high schools with a high Latina population. We will also create a phone app that will provide resources and additional information on safe sex that will be available to anyone needing assistance.
Research has shown that 49% of pregnancies in the United States are unplanned, and according to Healthy People 2020, there are 40.2 births per 1,000 teens ages 15 through 17, and as it can be seen on graph on the left, the number of teen pregnancies has declined. However, Latinas have failed to see such a decline compared to their other teen counterparts.
Target behavior is prevention of unintended pregnancy. Our target audience is the Latina Hispanic population, specifically ages 13 to 22 years old. The reason we chose behavior is that 49% of pregnancies are unintended. The age is chosen because women 19 years old and younger had the highest proportion of unintended pregnancies, and we chose the ethnicity/race because the birth rate among Latina teenagers remains the highest among all ethnicities in the U.S.
Our overall intended target audience is Latina women ages 13 to 22 years old living in San Diego County. We split this target audience into 2 audience segments. One segment specifically targeting young Latina women ages 13 to 18 years old, and then a second segment specifically targeting young adult Latina women ages 15 to 22 years old. The younger Latina women ages 13 to 18 years old are most likely high school students attending Montgomery High School or Southwest High School that may be thinking about having sex but may or may not be sexually active. Our goal is to educate this audience in an after-school program so that they can make responsible decisions when they are ready to have sex. Our second segment is specifically targeting young adult Latina women that are already sexually active. These women may still be in high school but may also be in college. We will be using a social media app with this audience to generate awareness and inform Latina women in efforts to reduce the prevalence of unintended pregnancies amongst our target population. Both audience segments have a shared secondary audience, which is the parents, guardians, partners, friends, and family members of our specified primary audience.
Our message is that increasing the use of contraceptives can reduce the rates of unintended pregnancy and also possibly lower risks of sexually transmitted infections. We plan on advertising our after-school program and our social media app through flyers, Facebook announcements, PA announcements, and mailing letters to parents. One example of our message that we will be using is, are you struggling with access to contraceptives? Have no one to talk to about safe sex? Join us after school. One of our peer educators are there to help you. Or you can ask us anonymously on our free phone app.
The public health theory we chose as the framework for our intervention is the social cognitive theory. Some cognitive factors that go into this are to increase the knowledge of safe sex and change the expectation about using contraceptives, along with ending the stigma around sexual education. The environmental factors are to change the norm and make people want to talk about reproductive health, and also to change the environment so that contraceptives and educational materials are readily available. And some behavioral factors are to empower the Latina population to make safer decisions, and also to give them the skills for proper use of contraceptives to increase their self-efficacy.
We use Kotler's 4 Ps as our health communication theory. Our product is represented as a reduction of unintended pregnancies among Hispanic and Latino women ages 15 to 22. For the price, we looked at the benefits, which are a decrease of pregnancy rates, prevention of emotional distress and financial strain, fewer costs relating to medical care, child care, and abortions, as well as education on reproductive health and contraceptive methods. The costs that we discussed were potential strains on the relationships between the parents and the children involved in our program, as well as peer judgment. The place in which we'll be promoting our program is at the schools, passing out flyers, having posters, and as well as sending letters home to the parents, as well as our social media app. And we will be promoting a message of increased knowledge of sexual education to prevent unintended pregnancies and safer sexual practice.